Hello, everyone. Today we have another patient that I would like you to hear her story and then what improvement she has felt with the expander and what we have done on her. We have Isabella here. I have been treating you since when? Almost a year?
June 30th of 21.
June 30th. And then tell us, Isabella, what brought you into my office? Like what you were looking for and what have we achieved so far?
Well, I needed braces, so I originally just came in to kind of get on a cool. And then once we did more of a proper search, we noticed that I did need some more work done rather than just braces. So when I heard about the expander, I did kind of do some research on it. And it seemed pretty interesting. It seemed like it would help a lot more than what I originally just needed. Because I did have a lot of problems when it came to breathing, especially at night. And then especially around allergy season, I would get it so bad. I'd constantly trying to have to use all these machines, all these medicines to try to help me just breathe alone. But after we heard about the expander and I talked to my mom about it, she thought it'd be the better route for me to be able to probably help more as my breathing and for my teeth.
Okay. So Isabella, when she came to me, this is her original bite. You can see how her upper jaw is constricted. If you have a narrow upper jaw, usually that means that also your nose is a little bit narrow. And it could be narrow to a degree that it will cause you to have mouth breathing where you can't breathe very well, as the case in Isabel. So if we expand the jaw, your nose will get wider and that will help you breathe better. We put not regular or traditional expanders, we put surgical expanders. And this is her x-ray before. This is your x-ray after. You can see the suture here is closed before, and then here you can appreciate how much expansion we have got. You can see we got 5 to 6 millimeters of expansions. You can see the space between the arms of the expanders. How was your experience with the expander, and when did you start to feel the difference in breathing?
Oh, it was almost immediately. As soon as the first few cranks here in the office, I went home and I was able to start breathing immediately better. And then over time, it was just a progress of it getting better and better. And I was completely out of having to use that humidifier to try to help myself breathe and stuff like that. But at first, it was a little bit sore. My mouth was sore. It was harder for me to say certain words and talk for a while. But then after a while, I think it took me about a week and a half, and I was back to normal. And there was nothing, I couldn't complain, basically. It did a lot more good than it did bad.
I remember that initially you did not get a space, and then you came back and told me, hey doctor, I got a big space right now, correct? Yes. That's a good sign. If you get a space, that means your sutures are opening. This is a very, very good sign. Yeah. Any other message that you want to tell the viewers or?
I mean, if you're honestly thinking about wanting to do the surgical expander, I would recommend doing it. It helped me so much. I've always had breathing problems, and if you do have breathing problems, this would help very much so. It's a very big benefit.
Thank you, Isabella. Thank you so much. Thank you, everyone.